Hello, my name's Norman Waterhouse. I'm a consultant plastic surgeon. I've had a reconstructive and an aesthetic practice for over 20 years, and for the last 7 years I've been in full-time aesthetic practice. The size and the scope of Expo 13 gives us the opportunity to appeal to everyone in the aesthetic and reconstructive sectors of surgery, and there will be many other features which will be facilitated by the scale and organisation. There will also be participation from industry leaders in terms of technology and advancement imaging equipment, and we will also have a teaching component, and I think this is extremely important for junior and trainee surgeons in all relevant disciplines. It's becoming increasingly difficult to access hands-on experience, particularly in the non-surgical arena, and this is an area that we're going to address. In terms of the aesthetic program, we will have a full program of surgical arenas, but there will be an emphasis on holistic care to educate surgeons on not just the operation itself, but the finer points of what makes an excellent aesthetic outcome. And this will also include very much attention to the skin. There needs to be a clear understanding for the public's perception of qualifications and registration, so that there must be transparency. If you go to see someone who calls himself or herself a plastic surgeon, that everyone understands what that means. At Cosmetic Reconstructive Expo 13, we are going to look at the issues around the PIP implant problem in some detail. And we're intending not just to have presentations from clinicians, but we'd very much like to hear from high-level politicians within the government departments, and we'd also like to hear from patients groups, and we will be hearing from manufacturers, and we'll be looking at this issue in some detail to see how we can prevent this sort of thing from happening in the future, and whether regulatory guidelines can help in that regard. There is, in this country, very little in the terms of formal regulations, and this particularly applies in the arena of non-surgical treatment. And even within surgery, there are some practices which I think would fall outside the guidelines produced by the Department of Health and by our national associations. But plastic surgeon seems to be a term that has been adopted by many people, and many of those people do not have the qualifications that a formally trained plastic surgeon has. And my argument is that the public really has a right to expect that their plastic surgeon is a plastic surgeon in the way that a heart surgeon is a heart surgeon. And because of all of those facts, I have been delighted to be approached by the organisers, and I am very happy to deliver for them what I think will be a national and international programme of excellence.